for everyone to get vaccinated. We need to keep fighting to contain the pandemic. A month ago, we spoke to Dr. Minna. He's a professor of epidemiology at Harvard about his game-changing home testing plan. For just a couple $1 billion, the government could provide everyone with cheap, rapid tests like those that have been started to use in the UK. Now, these are a tiny bit less accurate than the PCR tests you get from a healthcare provider, but you can test yourself every morning. And if it comes up positive, you just stay home. Now that we've got a new president who's trying to push through a big rescue package, including $50 billion for COVID testing, this seems like something that could be potentially on the table. So tonight, we're checking in with Dr. Minna and do a demonstration. He's from the Harvard T.H. Chan School of Public Health, who brought along some of these paper-based COVID tests to show you how easy it is. Dr. Minna, welcome back to Mad Money.
Well, thanks so much. Happy to be here.
Okay, doctor, before you came on, I used this Innova COVID-19 self-test kit. It took me 90 seconds to actually do it. Of course, we have to wait 15 minutes to get the results, but the results actually was available far earlier than that, but we did want to wait. All I can say is, how do we get these? How does everybody get these?
Well, these tests are being made today. The biggest issue is that the regulatory framework that we have to evaluate tests at the FDA is not keeping up with the science. It's evaluating these tests against the PCR, and the PCR is so sensitive it's catching people for a long time after they've been infectious. And so what we need is we need to get a new pathway at the FDA to evaluate these, show which ones are effective to catch people when they are infectious, and that's all that matters. Are you infectious? If so, stay home. If you're not infectious, no problem.
Now, it was very easy. I did a nose swirl, put the drops in this area right here, and then it showed me what to do. Now, this is something that I would imagine is far less expensive than the $30 to $35 tests I keep hearing about.
That's right. These tests, I have one in my hand here. These are selling for about $5. They can be anyway. And some companies are marking them up a lot, but this particular one by Innova is not. The Binax Now test by Abbott is also selling for about $5, but then they do have it associated with the e-medicine consult. So what we really need to do is get all the prescriptions out of this, get the e-medicine consults out, unless people are truly sick. But if we want to use this for surveillance, for personal surveillance at home, so that I know if I'm safe generally to go to work or school, then we don't need doctors involved. We can just get people to have these cheap, rapid tests that are available at home.
Do you have examples where, without disclosing anything that might be a test, where it is working, where we know that you've cut down the number of people getting sick?
Absolutely. This particular test, this Innova one, we just finished a large trial on college campuses, and what we found was when we were using it every couple of days, the test has been nearly 100% sensitive to detect people before they even get their PCR results back. So we've been finding that it is working as well or better than the PCR test to give immediate results, find those who are infectious, and stop them from interacting with their peers in that case.
Now, I want to make it clear, as great as this sounds, we are not in a situation where you can go on Amazon and buy these, correct?
For the most part, you can. Some of them will come around, but they will still have these e-medicine consults linked to them. So there's still a lot of other baggage that will be associated. So for the really cheap ones that are working exceptionally well, unfortunately, they're not quite available yet.
And yet, I would say, in terms of what's going on in the country, we want to have an affordable solution. We don't want a solution that just can benefit rich people.
That's exactly right. These tests are, one of the best things about them, in my opinion, is they can make testing equitable. Not only do they make testing fast and accessible, it's a new level of equitability. Doesn't matter how rich or poor you are, especially if the government purchases them and gets them out to people, but the tests are so inexpensive that anyone can use them, anyone can have them available to them near daily for use. You brush your teeth in the morning, you use a COVID test. If you're positive, you don't leave the house. If you're negative, you do everything else the same that you would have otherwise done.
Okay, so let's posit what happens if people who got it, had it, haven't given it to anybody yet, and stayed home. Do you imagine that we could have a caseload that would be dramatically diminished or somewhat diminished?
Absolutely, dramatically diminished. I'll put it this way. If we could get 100 people to go on and infect just 90 people. Doesn't sound very good. 100 people who are infected go on and infect 90. Right now, 100 people go on and infect 140, 150. But if we can get them to infect just 90, and we do that for 4 weeks in a row, we get a 90% reduction in where we otherwise would have been. We can dramatically diminish cases in a month.
All right, well, with that, I have to ask, how can we make this happen? What do our viewers have to do to make this happen? Because this is the kind of thing that I want to make a huge cause, because you are dead right about this.
Well, I think that one of the biggest things is these tests, we need to make sure the money is there, and I think that the president's plan is putting the money in place to make sure tests like this can become available. And now we really need to make sure that the FDA and others are keeping up with the science, that the regulation isn't getting stuck in where it was last February, that we're keeping up, we're recognizing the limitations of PCR, we're recognizing the benefits of fast testing, and we push for new regulation at the federal level to ensure that every American can get access to these tests, ideally tomorrow. We could be stopping this pandemic, in the very near future in the United States.
Well, let's hope President Biden or some of his team listen to what you just had to say, because I think it's the most important thing that we can do at this very moment to try to stop the pandemic. Thank you so much to Dr. Michael Mina. Always great to see you, sir. You really make a big impact on everybody's life. Thank you. Dr. Mina is up at Harvard, Chan School of Public Health. Remember, it's public health. That's the real issue. It's not medicine. It's public health. Big difference. He's going to make a difference. You can make a difference. Bad Bunny's back at you.